It's P Chimes from Lake Washington Sports and Spine, and what I want to talk about is blood and the healing capacity for musculoskeletal injuries. I was listening to the Joe Rogan podcast, and they were having a discussion about his meniscus. He's a guy in his 50s, and he was told by his doctor that it doesn't heal well if they were just to do a surgical repair, and he didn't understand that. He's thinking, hey, I'm very fit in my 50s, so isn't my knee like that of a 20-year-old? And the answer is, for the meniscus, the answer is no. And I think it showed some fundamental misunderstandings. So I wanted to talk about the role of blood for different musculoskeletal injuries. So what makes musculoskeletal tissue, it has a capacity to heal. And one of the things is that blood is the delivery system for getting healing factors to an area of injury. So the classic case for something like that would be like a muscle. So what I'm showing here is a muscle belly with a tendon on either side. And muscles have really rich blood supply. So for example, my 2-year-old son bit his tongue and just bled everywhere and it was very messy. And the whole thing that made it kind of scary because of the blood is the same reason that it healed super fast, because tongues have a wonderful vascular supply, so within 2 days he was fine. And as a general rule, if something bleeds a lot, it has a really high capacity to heal because the blood supply can also deliver nutrients to the area. So I think what Joe Rogan was thinking about was the fact that because he exercises at a high level, he has a better blood supply to a lot of the structures in his body, and that might be trainable. But there are other areas of the body where that's not true. And the main issue is just the blood supply to those areas tend to wither and atrophy as you get older. And they give 3 examples. One is from the hip, one is from the knee, and one is from the Achilles. So when we look at a hip, what we're looking at here is that this is the hip blade called the ilium, and the cup of the hip joint is called the acetabulum. And then this is the femoral head, and then this is the thigh bone shaft, and much shorter than the actual diagram. So in the femur, the femoral head has 2 blood supplies, one that comes from the neck going towards the cup and one coming outward. And in newborn, you have a rich blood supply for both, but the supply that comes from the cups tends to go away, and that's not really a trainable event. It's just the artery goes away, it becomes a ligament called ligament teres, and that's one of the reasons that femoral fractures are such a big deal, because you lose some of the blood supply to the femoral head, and it can create a condition called avascular necrosis. And that's not a trainable event. It's also one of the reasons why when we have patients who have things like labral tears or hip osteoarthritis, using regenerative medicine treatments like platelet-rich plasma or micronized fat is important, because the healing factors might not be able to get there on their own. What I'm looking at here is a knee. So we're looking at is the thigh bone or femur, the shin bone or tibia, the patella, quadriceps tendon, patellar ligament, and the black here is representing the meniscus. What the meniscus is a type of fiber cartilage similar to my earlobe, and the surgeon who was consulting Joe Rogan, was giving him appropriate feedback. The blood supply to the meniscus tends to shrivel up probably around late teens, early 20s. So if you have a kid who has a meniscal tear and you do a surgical repair, it can heal really well because there's a good blood supply. But by the time you get into your 30s, 40s, 50s, or older, the meniscus really doesn't have a great blood supply. And again, this is why it's not a trainable thing. You can't train those arteries to be better, but you can put healing factors into the area, which might be of some help. The final picture of what I'm trying to show here is the foot. This is specifically a bone called the calcaneus, and that's going to be the calf muscle, and the Achilles is this big, thick, robust tendon that attaches to the calcaneus. There's 2 major kinds of Achilles injuries. There's an insertional injury and a non-insertional injury. The insertional injury is something you see often with people with autoimmune disease or young kids. The non-insertional region is a disease that classically affects middle-aged men, often as they're going through metabolic syndrome or having their testosterone levels drop. One of the reasons that's an important issue is that it's actually at a watershed area where there's a blood supply that comes from the bottom and a blood supply from the top, and that is something that tends to deteriorate. Now, it's not really trainable, but you can improve the vascularity by improving your metabolic health. And so so it's not a matter of doing more exercise in that region necessarily, but there are things you can do to improve your metabolic health, like making sure you lose weight, improve your testosterone, improve your sleep. So the whole point on this that I want to get across is that for musculoskeletal injuries, it's really important to get nutrients in the blood there. Sometimes those are things that are trainable, sometimes they're not. and sometimes we can put healing factors directly at the area of the injury to promote healing in those areas that you can't get blood to otherwise. So this is Gary Chimes at Lake Washington Sports and Spine.